Hello and welcome to NCTV episode 85, which is all about spinal disc problems. First of all, it's important to know what a spinal disc actually is. Without getting too technical, they are basically your elasticity, rubbery shock absorbers which are located between each vertebrae, and they help allow for a wide range of movement to occur in the neck and lower back. So why do problems occur with the discs? Most of the time, it's because of the amount of pressure that gets put through them. It's either down to excess stress on the discs, infection, or the aging process leading to degeneration. Specific causes of disc problems are heavy lifting, incorrect bending and lifting posture, overstretching and slips, falls or trauma. Other risk factors that can lead to issues with the discs are aging, smoking, lack of exercise or exerting too hard, lots of driving, overdoing the gardening, a sedentary lifestyle, being overweight and having poor posture. Symptoms of disc problems are back pain, muscle spasm, numbness, pins and needles and muscle weakness, as well as difficulty bending or straightening up. You may also experience pain with coughing, sneezing, laughing or straining. Not all damaged discs cause symptoms though, and it's possible that you may have a herniation, for example, but never actually know about it. Onto the actual disc problems themselves, and there are only two really main ones to mention. The first is a herniation, also known as a disc bulge or prolapse. These are things many people refer to as slip discs, although most of the medical profession aren't actually keen on that expression as it's not technically what's happening to the disc. A herniation is where there's a breakdown of the outer fibres of the disc, and this results in the toothpaste substance in the middle usually being pushed out through the broken fibres and into the spinal nerve roots or spinal cord. And because the substance of the disc is highly inflammatory to any nerves that it touches, this can put pain down the nerve following the course of the arms, for example, or in the lower back it might lead down to the legs and feet, which is also known as sciatica. But remember, sciatica is just a symptom of something else, such as a disc herniation, rather than a diagnosis itself. The second main disc problem is known as degenerative disc disease, which causes pain either directly in the back or referred pain elsewhere, such as down the leg. It can occur as part of the aging process, and it's where the spinal discs start to dry out, meaning that they begin to lose some of their flexibility and shock absorbency, and in turn the fibres can then tear, causing pain. A potential red flag to look out for is something called corner equina syndrome, where you may experience numbness around your genitals and anus, known as anaesthesia, whilst also experiencing incontinence. If this happens to you, you should attend A&E without delay. A disc problem usually gets better slowly by itself with a combination of rest at first, then some gentle exercise. And alternating between ibuprofen and paracetamol can also help if need be. To potentially speed up the recovery process and manage disc problems more effectively though, a few options are manual therapy, such as osteopathy of course, chiropractic treatment, physiotherapy, intervertebral disc decompression or IDD therapy, massage, acupuncture, to name but a few. If you're really suffering, stronger painkillers such as codeine can also be prescribed by the doctor, or a steroid injection may also be given. Aside from that, as a last resort, spinal surgery may help if the problem is really serious or not resolve following more conservative methods. The recovery time following a disc problem can vary depending on its severity, but generally speaking it could take between 8 to 12 weeks to heal on average without treatment, and usually about 6 weeks with treatment, but potentially in some unfortunate few people, pain can last up to around 6 months or even a year and beyond. The breakdown and weakness of the disc fibres can't be undone, so there may always be a weakness there going forwards, but in terms of preventing recurrence, adopting safe lifting techniques of heavy items will help, as well as rehabilitative exercises and strengthening work on the core and back muscles to minimise any future problems. Many find the likes of Pilates, Tai Chi, yoga helpful, as well as ongoing periodic maintenance type osteopathy treatments, for example. Essentially addressing the underlying cause and minimising the risk factors mentioned earlier will stand you in good stead. So that's it for this week's bite-sized bit to help your health flourish, and I'll see you again next time. Bye-bye for now.